Welcome everybody to the 8th session of Growing Stronger's LP Doc Talk. Today we have with us Dr. Shawn C. Standard, who is the head of pediatric orthopedics at the International Center for Limb Lengthening. Originally from Atlanta, Georgia, Dr. Standard came to the ICLL in 2003 from the Distinguished Nemours Clinic in Jacksonville, Florida, where he started a combined general pediatric, orthopedic, and limb deformity clinic. An internationally known surgeon, Dr. Standard has expertise in the treatment of limb deformities with a special interest in skeletal dysplasia, or dwarfism. Dr. Standard also takes his expertise overseas, serving as a volunteer orthopedic surgeon in countries like Grenada and the Dominican Republic. So welcome to the session, Dr. Standard.
Great, thank you very much for having me.
You're welcome. And we also have with us today special guest, Chandler Crews. Chandler is a 22-year-old nursing student at the University of Arkansas at Little Rock. Chandler was born with the most common form of dwarfism, achondroplasia. In 2010, when she was almost 17, Chandler went to the International Center for Limb Lengthening. Since 2010, she's had a total of 3 limb lengthening procedures, lengthening her legs twice and arms once. She's been documenting her journey on her Facebook page called Chandler Crews, formerly Chandler in Baltimore, and has begun a Facebook group with a friend called LEAD, Limb Extension Awareness for Dwarfism, a positive forward-thinking group which invites all to openly discuss the concept of limb lengthening for dwarfism. Chandler also serves as the district director of Little People of America for Arkansas, Kansas, Missouri, and Oklahoma, as well as working for Growing Stronger. So Chandler is here to offer the patient perspective of any of your questions. So welcome, Chandler. Thanks for being with us.
Thank you for having me.
And at that, Dr. Standard, I'm going to hand it on over to you.
Okay, great. I have a list of questions that I'd be happy to answer and hopefully expound on a little bit. And Chandler, if you feel like there's something to jump in and add, I would be greatly appreciative. Having your perspective as well is very important. The first question reads, my daughter is 10 years old. Is it okay to begin lengthening the arms first before lengthening her legs? And along with that question is, can a child of the age of 10 handle such a life-changing and heavy operation? What can go wrong, complications during surgery, and how often does it happen? What are the things we need to think of when she is home after surgery for her well-being and state of mind? Is it okay that she's having doubt? She's talked about the surgery and says she wants to do it, but isn't 100% sure. Can someone really be 100% sure? So that covers a lot, and we'll start one at a time. But these are great questions. And so, at the age of 10, can you begin lengthening arms? And you can. The protocol typically for, and we'll kind of go through a prototypical case of achondroplasia or hypochondroplasia. There's over 200 types of bone dysplasia, and each of them have their own particular issues when dealing with orthopedic treatment, and some have, and many have, other issues with other organ systems or other issues that need to be certainly addressed to make sure that surgery or any type of elective surgery is safe. As far as hypochondroplasia and achondroplasia, lengthening can begin between the ages of even as young as 8 years of age. Typically, if someone is looking to start early, between 8 to 10 years is a good starting time. Typically, the protocol begins with bilateral lower extremity lengthening both the femurs and the tibias, while at the same time correcting any deformities that are present, meaning any bowing, any twisting type deformities, any other gait problems or joint problems you'd like to address either at the same time of lengthening or even prior to lengthening. The second stage is a second limb lengthening, usually around the age of skeletal maturity, which means as the long bones finish growing, typically in the age 14 for girls, 16 for boys, the second lengthening is performed, and then the final lengthening is the arms. That protocol was established by several doctors. We all do it a little bit differently. And at the Rubin Institute for Advanced Orthopedics, that's kind of the prototypical schedule. However, everyone can modify and change that depending on their needs. First of all, lengthening is not for everyone. And if lengthening is for you, then it might be a single lower, leg lengthening. It might be a lower extremity lengthening one time. It might be a one-time lower extremity lengthening and a arm lengthening. It might be the full protocol. I've had some patients who've done 3 lower extremity lengthenings and 2 upper extremity lengthenings to correct deformities and add length, all depending on proportionality and function. If I meet a young person, and this is a young girl at age 10, and she's having significant problems because of her arm length with day-to-day care needs, bathroom self-care, then certainly you can do arm lengthening. There is some concern by doing extensive lengthening, because these lengthenings are extensive, that could you perhaps inhibit normal growth of such a young child. It is theoretical, but I have not myself seen that. We do have literature, but it's more in line with congenital limb deficiency lengthenings and not with bone dysplasia lengthenings. So from a doctor's point of view, extensive lengthening in a younger child with open growth plates theoretically could slow the growth plates down because of pressure, but I've never seen that. So I myself am happy to perform a arm lengthening at the age of 10, and you can gain anywhere from 2 inches to 4 inches of arm length from the upper arms, the humerus. You do want to take into consideration, is leg lengthening being considered? If it's not, and it's just arm lengthening, then you want to provide a functional length, but you do not want to create significant disproportionality, because the families will not be happy. And hey, Chandler.
Yes.
I'm right in the middle of that, and I'm sorry, I know this is being recorded. My little one's called. I just want to close my doors real quick.
Oh, you're fine.
I think mommy is taking care of little Peanut, but okay, sorry. So so you definitely can do your arms first. Can a child of 10 handle such a life-changing heavy operation? They can. That was a concern early on, and we would perform maybe only bilateral femoral or upper leg operations, and then followed by bilateral lower leg operations. And in concern that a younger child, would not be able to tolerate both femurs, both lower legs, tibias, and fibulas being operated at the same time. And what we come to find out is that they do very well. It is a significant investment in time, and usually the patients are not local. Most of my patients come from out of town, so it's a huge investment of work and time and effort on the family's part, along with the patient, and Chandler can attest to that.
Mm-hmm.
And it's definitely a journey, and I think that's when you really have to, I think as a family, explore the options, talk to an experienced surgeon who treats this often, and also to.
I would also say, like, talk to other patients who have gone through it and their families. Especially, like, I think I get a lot of questions from mothers asking questions about, how did you go through it and something and all that. And I think moms should also, like, message other moms of, if their child's gone through it, so they can sort of get, that sort of mom and mom, I don't know what the word I'm looking for is, But, you know, when I'm answering to a mother, I feel like that's different than if my mom was to sort of answer to a mother who's considering the surgeries for their children.
Yeah, I think that's great. I think the different perspectives are extremely important when trying to prepare yourself. And you can never 100% prepare yourself, at least, and Chandler can answer that also. But I always highly recommend families to first meet a doctor and meet an institution and understand the undertaking that they're considering and all the time and effort implications. At the same time, like Chandler said, I have performed thousands of operations, but I've never had to care for a child who's undergoing bilateral lower limb lengthening myself. So that's where the family knowledge comes in and the wealth of parental knowledge that we have, especially in my practice and the wonderful kind of community that's developed, that people are very willing to share each other's experience. I call that this parental knowledge base. You know, how do you get to an airport with external fixation devices on? You know, what does the magnet look like? How to get the magnet through security? How do you travel in a car? Yeah, well, you know, what kind of clothes do you wear? And all of these things. How long does it really take? What are all these things are extremely important information. And I think the more you know and the expectations, especially of a younger child, you can really manage better. And there's certain signs, you know, if a child 8, 9, 10 is, you know, can't wait to wake up with, you know, arms and legs like, you know, like mom or like their brother, if they're, you know, and that's an unrealistic expectation. You know, one, we're all different and we all have our individual pluses and minuses and challenges and good things and bad things. And that maturity is, you know, very important for this type of undertaking. I operate on children as young as, you know, 1 year of age for limb lengthening and deformity reconstruction, all the way up to adulthood. And the different procedures require different levels of maturity and understanding. And this is definitely one where that's extremely important. Meaning that would you undertake a bilateral limb lengthening at the age of 5 or 6? And you shouldn't, at least not in my practice. They're not prepared for that. You can do deformity correction, but not extensive lengthening. So I think that answers can a child of age 10? They can. And I've had multiple examples, many patients, and just Chandler's one who can, even though Chandler is a little older, but still, it's amazing what the patients can show you that they can do. But you know, and it is a journey, and everyone takes a little bit different road in the journey, meaning their goals, but the goals aren't the penultimate of achievement. If you come in looking to increase the leg length by 4 inches, and at the 3-inch mark, you know, there's some signs that say that the body has had enough, then that's when you need to stop and regroup and understand that that's what your body can take.